Hey everyone, this is Renasha Williams and I'll be presenting on the Chikungunya virus today under the One Health, One Medicine. Here I'll be giving a brief background on the virus. The Chikungunya virus is a mosquito-borne viral disease first described during an outbreak in southern Tanzania in 1952. It is an RNA virus that belongs to the alpha virus genus from the family of the Turoviridae. And this actually got its information from the World Health Organization 2016. Here is a map showing, well, not really showing the whole spread of it, but it actually showed the Americas. The first outbreak, as I said, was in 1952, and the last outbreak is actually ongoing. And the first time the virus actually showed up in the Caribbean was in the year 2013. The outbreak also occurred in Africa, Asia, the Indian and Pacific Ocean. Here is a picture depicting of how the virus actually spread across the globe. And here we also seeing the Caribbean, which the first case was founded in October 2013. The transmission of the disease actually transmitted by the bite of an infected mosquitoes. This is such as the Aedes aegypti and Aedes albopictus. Sorry for the pronunciation again. Here we have an incubation period of 2 to 6 days. This is actually two pictures depicting of the mosquitoes. They actually look pretty similar for me, so I'm not too sure the big difference. The virus is also transmitted through mosquito human. The mosquito becomes infected while feeding on already infected person with the virus. So if I'm infected and a non-infected mosquito came and bit me, it will also get the infection and it will go ahead and bite someone who is not already infected. So that is actually how the mode of transmission occurs with mosquito to humans, and also with animals to humans too. There is no cases of mother to child or newborn transmission recorded. There are also no case of the virus being spread through blood transfusion. The symptoms actually start after 3 to 7 days after being bitten. Transmission also occurs. Sorry for that. Local transmission have been identified in 45 countries or territories throughout the Americas, with more than 1.7 million suspected cases reported to the Pan American Health Organization from the affected areas. Actually, the Chikungunya virus is a personal topic for me because I was also infected during the year of 2013. So here's a picture showing how the spread of disease actually occurred. Signs and symptoms is actually joint pain, which lasts for months to years, muscle pain, headache, joint swelling, generalized weakness, rash, fever lasting for 2 to 4 days with a temperature of 104 degrees Fahrenheit. Your persons also experience nausea, vomiting. Diagnosis, clinical history. Based on what the doctor actually see while is he doing a physical examination. Signs and symptoms. Blood investigations is, I could probably say, is one of the main form of diagnosis currently. And normally they will look for the reverse transcript polymerase chain reaction, and it is used to detect the RNA expression. Unfortunately, it's unavailable in the Caribbean. So if persons have to do the test, they will actually have to go overseas or send the blood samples overseas. Also do serological tests, which used to detect specific antibodies, and also ask the person for the history of traveling and if they travel to infested areas with the virus. Persons at risk, everyone is at risk. Persons older than 60 and over, and newborns at very high risk. Person that suffer from diabetes, hypertension, heart disease also is at high risk. Persons who travels from Asia, Africa, Europe, the Caribbean, and the Indian and Pacific Ocean, as I said, places that is infested with the disease. Prevention, you protect yourself from the mosquitoes. You use repellents. You wear long sleeve shirts, long sleeve pants. You keep the surrounding clean at all times, and you empty out all stagnant water that would be in containers in and around your homes. We'll practice proper garbage disposal. You use mesh on windows and doors, proper water treatment, and the use of foggers. We actually use those in the Caribbean on a mass scale to control the spread of the virus. Case management. There's no medication, no vaccine to prevent or treat the virus. One of the first things they would prescribe to you is to rest. You have fluid intake, which prevent dehydration, medication acetaminophen to reduce fever and pain. Also, you avoid the use of aspirin, which would increase the risk of bleeding. If persons had already been infected, they asked to prevent further bites from mosquito in the first week of the illness. And here's my reference page. Thank you.